Today with Raechelle Devereaux, the Chief Executive Officer of the Guelph Community Health Centre. How are you today?
I'm great, thanks. How are you?
Wonderful. Please tell us a little bit more about the Guelph Community Health Centre and the community that you serve there.
Sure. So the Guelph Community Health Center is a comprehensive, multidisciplinary primary healthcare organization operating in the community of Guelph, Ontario. Our population is about 130,000, so an urban community health center. And we are located, one of our main sites is in the downtown of the city of Guelph. We employ just under 160 interprofessional staff, ranging from physicians and nurse practitioners and registered nurses to food security staff and parent outreach workers working in neighborhoods. And we focus our efforts. I like to describe our focus of community health centers as being our mandate being to figure out who in the community has the greatest barriers to health and well-being, and designing our unique suite of services of wraparound care, uniquely designed to meet those needs. A friend once told me that a CHC is a bit like a boutique, and I think it sort of fit, because in a boutique, the services and supports are tailored for the customer. And that ultimately is how we apply resources, is needs-based, based both on the community's needs and our populations that we serve.
That's perfect. And so we do know that Ontario is fortunate enough to have a large number of community health centers. But do you still see gaps in terms of individuals or groups that need more access or would really benefit from a community health center?
Yeah, a few years ago, our provincial association did a review and really recommended that the province of Ontario, around 22% of the population in any one community could greatly value from the needs-based wraparound model of a community health center, really recognizing that about 22% of our population experiences barriers and that we could offer best matched care to that population. And so in the city of Guelph, we're serving only about 4%. And so when you think about that gap of the number of clients who ought to or would be best served by a model of care such as ours, you really need to have resource investments to grow our team care. And what you would have as a benefit from that is, I believe there are many people right now who are matched to more traditional primary healthcare resources, and they aren't getting that fulsome wraparound supports of an outreach worker, perhaps, or addictions and mental health built into their team care model. And as a result, we see inappropriate or inefficient uses of resources in healthcare, namely emergency department visits. Or worse, we see people dying of otherwise preventable chronic diseases because that care isn't being afforded to them.
Of course. So the Guelph Community Health Centre operates a number of services which you described that focus on people's detriments of health beyond healthcare, like food security, early years supports for children. Do you see particular areas where increased federal investment in community health centers would enable you to increase your reach and improve the health and well-being of the community that you serve in Guelph?
Absolutely. I believe that when we talk about the social determinants of health and we acknowledge that income and food and housing are so important to one's health and well-being, and we don't invest in those, we reap what we sow. And ultimately, we see that the highest cost drivers are people who are experiencing homelessness, who have acute unmet mental health and addictions challenges, and who are struggling with some of the greatest complexity. That doesn't just affect healthcare. It affects families, it affects neighborhoods and communities, and it affects business. Those are folks who aren't able to shop at the grocery store, who aren't paying rent in an economy, and ultimately don't have many of the advantages of many of the economic participation that we have in a community. So when we think about what we know to be what we consider here in Guelph one of the primal social determinants of health, being the experiences that a child has in their first early years, and then the building of supportive relationships and protective factors around early childhood trauma to build resilience. We know that early childhood trauma changes brains, and that influences health in huge ways across the lifetime. When we invest upstream, when we invest in wraparound care around our community, families, and children in our neighborhoods, when we build opportunities for trusting relationships within networks and within villages and build that care, we transform health outcomes. However, it's really challenging to lobby or to get that policy investment because we're really focused on the fire. We're really focused on the need to put out the fire. We're focused on overdose, and we should be. We are in an overdose crisis. We're focused on acute emergency department usage. And so we build bigger hospitals and we put investments in hospitals. But if we were to actually take a real health approach and were to move upstream in order to change the future health of our communities, we could actually reduce the need to fight the fires. And I think that level of will, and it is will, it's political will, but it's also the ability to say, that matters to us. That matters to us. The future health of generations matters to us. Similarly, that we need to create the case for the environment matters to us, and it's our duty to protect it. And I think that that's a space and place that the federal government could 100% focus on in terms of investments in community health centers. We already have a foundational social determinants of health model. We already are relentlessly working on food security, early childhood development, housing solutions, and income solutions, but we're working within the existing system. And the existing system is wrought with barriers. So instead of employing staff to lobby and to work to try to help our clients over the barriers, the federal government could work with community health centers to actually take the barriers down and redesign an equitable system that prevents the future health costs that we're currently seeing right now. We want to stop pulling people out of wells. We want to stop pulling people out of burning buildings. I want there to not be a lineup outside my building right now to use our overdose prevention services. However, that won't happen until we start to invest in families, communities, food security, housing. And we know that, and we say that, and we tell really important stories about it, but let's actually show our commitment to our values with investments. We see one's commitment to their values through their budget. And so that's really ultimately what I think is possible through federal investment in community health centers.
I think that was incredibly insightful. That's great. Thank you so much for your time today, Raechelle.
You got it. Thanks so much.